come with me to go study at a coffee shop. So I decided I'm going to wear scrubs now whenever I study, so that way when I go somewhere I do not have to think about what I'm wearing, and I'm also in the zone. So I decided to do my makeup a little. If you look good, you do good, or if you look good, you feel good, you do good, right? So this is me just applying my eyebrow gel from e.l.f. and then going in with my Milk Jelly blush. I love it. So I'm applying it to my cheeks. I also use it on my lips because sometimes my lips, for whatever reason, I feel like they look pale. So that's me applying it. And then, of course, my chapstick. Strawberry is my favorite. I wouldn't say flavor, scent, whatever you call it. But I am obsessed with chapstick. I don't know if any other fellow nurses feel this, but my lips are just constantly needing chapstick. And I do drink water throughout the day, so don't even judge me on that. Then my favorite mascara, of course, Thrive Cosmetics. It's a tubing mascara, so it's so easy to take off, and it lengthens my lashes, which I'm obsessed with, obviously. So I also got to make sure that I clean off the excess mascara and make sure my hair looks cute, even though it's just thrown up. And here's my full outfit. Blue Air Forces to match. And I went to a local coffee shop called Lavender and Honey. There wasn't anywhere to sit. I was super anxious, so I decided to sit on the counter. These are the 2 patients that I was assigned to at shift change. We did the whole SVAR thing, so I had to make sure that they had told me everything correctly, and I went through the vital signs, the orders. This is me stressing out because this is taking a lot longer than I thought. And here she's telling me about a patient, which I also got a patient transfer to care. So I ended up having to come back home because I needed the bathroom, and of course I had anxiety, so I was scared to leave my things at the table. I sat by somebody because I finally got a table with a guy who was like, hey, can I sit with you? And I was like, yes. And then there was a table for 4, and I was like, you know what? I didn't want to grab that table by myself because I didn't want to look selfish, but let's grab it together. And he sat there, so I sat there with him. And then I was like, I really need the bathroom, but I don't want to leave my stuff with him because I don't know him. No judgment at all, because he would walk outside and leave stuff with me. But I just get really nervous and anxious about going to the bathroom, and then there's a whole code needed. So it was just too much. So I just decided to come home. But I did get transfer of care for a patient whose chest tube, the order said not to clamp, and the nurse before me clamped it. So of course the patient was having trouble breathing, but we got that solved, and I just had to learn how to address the situation and talk to her in a way that did not come off accusatory, just like, hey, what kind of happened here? I see that the order said this. Did you read the order differently? It was just, having to learn to communicate properly and professionally, and then delegating tasks to unlicensed professionals, and letting them know that if they do see the patient in distress when they drop off water, i.e. that chest tube patient wanted a cup of water and the unlicensed professional took them a cup of water, noticed that they were short of breath, did not say anything to me, and then I noticed that they were really struggling when I went in there and the chest tube was clamped. So it was kind of like, do not make them feel guilty, because it's not their issue to look at the chest tube. It's not their responsibility to look at the chest tube and assess it. It's mine. But if they notice that the patient is uncomfortable, they do need to communicate to me, because we are a team.